Concerned about.
Tonight we talk to local doctors separating the facts and fears from the Zika virus.
You've heard about it. Now the Zika virus appearing here in Texas and at least 10 other states.
The latest round of worry started in Brazil with an outbreak of Zika. Doctors have seen a number of children born with microcephaly. More than 4,000 babies, in fact, born there with abnormally small heads and brains. The concern is cases of Zika infections are moving north. The Centers for Disease Control says active Zika virus transmissions are found in most of South America, the U.S. Virgin Islands, Honduras, even Mexico. Now, 3 cases have been reported in the Houston area with returning travelers. And the mosquitoes that carry the virus are common here in the States along the Gulf Coast. KXAN's David Scott got us answers on how much you really should be concerned.
Only travelers to Latin America have to worry for now. But if you do get the symptoms, check with a doctor, especially women with child.
Anyone who is pregnant and is coming back and develops symptoms, we would be, I think, contact the local health department. Will assess each situation.
As the case warrants, the patient would be treated by the CDC. As for the prediction out of the Baylor College of Medicine that Texas is the perfect storm for it to develop here, our local health officials admit they're worried.
It's something that we're very concerned about. We want to do everything we can. There's no prevention. There's no vaccine for this. The main prevention is mosquito protection.
At a health symposium in Austin today, the Houston doctor who recently treated a woman who returned from El Salvador with Zika. She's fine now, but he too is worried that the type of mosquitoes that spread the virus are in Texas, ready to breed in warmer weather.
It's likely not a scenario of if our mosquitoes will get Zika virus, but it's more of a when our mosquitoes will get Zika virus.
Only 1 in 5 with the Zika virus will feel any symptoms at all, and they're reasonably mild. The danger? Pregnant moms getting it and passing it on to their unborn child. That could lead to birth defects, incurable brain birth defects. David Scott, KXAN News.
The symptoms of Zika virus are similar to other mosquito-borne diseases such as dengue fever and chikungunya. But again, not everyone shows symptoms. A fever, a rash, joint pain, and headaches can also happen, along with red eyes or conjunctivitis. Being put in the hospital is very uncommon, and death is even more rare. We have more facts and information available on KXAN.com. We also have tips on how you can deter mosquito breeding around your own home.
Looking at prevention, we showed you on Wednesday, UT researchers were working on an inexpensive way to test for the viruses in mosquitoes. Well, one method would even utilize a portable box with LED lights, allowing you to analyze a dead mosquito on the spot. You can check out that story at our website. Scientists in the United Kingdom are purposely introducing more mosquitoes into the air. They are all genetically modified males and cannot survive long outside of the lab. They mate with the females, and their offspring do not survive into adulthood, preventing the virus from spreading to the future generations of mosquitoes. Studies show the tactic wipes out 90% or more of the specific problematic population of mosquitoes. That's better than some of the better cases of chemical programs. The FDA is in the process of reviewing it for use here in the United States.